Welcome to NCLEX Academy. Let's start today's session with a question. What is the dose of tetanus toxoid? So before giving an answer, let's learn briefly about tetanus. Tetanus is a bacterial infection caused by Clostridium tetani. This bacteria produces toxins mainly affecting the nervous system, leading to severe muscle stiffness and spasm. Often called lockjaw. Why? Because it causes stiffness in jaw muscle, making difficult to open the mouth. There are generalized tetanus, which affects widespread muscles. Then localized tetanus, confined to area near to the wound. Then cephalic tetanus, that tetanus following any head injury which affecting cranial nerves. Then tetanus specific to newborns, neonatal tetanus. Tetanus bacteria is found in dust, soil, and animal feces. How this infection occurs? When the bacteria spores enters the body through puncture wounds, burns, animal bites, cuts or wounds contaminated with dirt or soil. In case of neonatal tetanus, portal of entry is umbilical cord stump. This occurs when the umbilical cord is treated with non-sterile instruments or substances. Produced by Clostridium tetani is tetanospasmin, which is responsible for almost every symptoms of tetanus. Tetanospasmin can block the nerve signal transmission and it causes severe muscle spasm and rigidity. If it affects the jaw, neck and throat, difficulty in swallowing and difficulty in breathing occurs. Since it is an inflammation, inflammatory mediators like cytokines will be released and it acts on hypothalamus, causing fever and sweating. Then headache and irritability, because tetanospasmin can cause increased ICP. Severe painful muscle spasm will be there, rigid abdominal muscles will be there. Everything is responsible by tetanospasmin. Neonatal tetanus is otherwise called seventh day disease because symptoms usually appears within 7 days of birth. The symptoms include poor feeding because the jaw is affected, lockjaw is there, then irritability because ICP may change. Then opisthotonus. Opisthotonus means you can see the figure. The tetanospasmin produced by Clostridium tetani can block the neurotransmitter gamma aminobutyric acid. Actually, this transmitter helps in preventing hyperexcitability of the neurons. So, by inhibiting GABA, flexor muscles and extensor muscle contract simultaneously. So it leads to severe rigidity and the paraspinal muscles of the back become hyperextended, including the neck and head. This is opisthotonus position. In adult, opisthotonus indicates severe tetanus. Then even with the small stimulus, the spasm get triggered. Then fixed expression, which is due to facial muscle contraction. Then respiratory muscles are affected, so respiratory problem is there. Because of that, cyanosis is there. Due to hypothalamus activation by inflammatory mediators, fever, sweating will be there. Regarding treatment, wound care to remove the tetanus spores. Then tetanus immunoglobulin to provide a passive immunity. If immediate action is needed, tetanus immunoglobulin is preferred over tetanus vaccines because it acts more faster. Directly we are giving the antibody itself. In case of tetanus vaccination, time will take to produce antibodies. So, if immediate action is needed, use tetanus immunoglobulin. Then antibiotics like metronidazole, muscle relaxant like diazepam can be used. So, to prevent neonatal tetanus, sterile equipments can be used to cut umbilical cord to prevent the entry of the tetanus spores. Then maternal vaccine, 2 doses intramuscularly, 0.5 ml, 6-week gap. First dose at 16 to 24 weeks and second 2 weeks prior to delivery. And remember, if mother has completed 2 doses of TT vaccines in her current pregnancy, for her next pregnancy she needs to take only 1 dose provided that pregnancy is within 2 years and can take in last trimester. Okay, then as a part of vaccination, routine vaccination schedule, tetanus vaccine can be given as DTP, Tdap or TD vaccines. As per KSA, that vaccine is at 2 month, 4 month and 6 month, then 4 to 5 years, then booster dose every 10 years thereafter. Let's see the vaccine types and uses. Tetanus can give in different formulations: DTaP, Tdap, and Td. Diphtheria, tetanus, and acellular pertussis, DTaP. This acellular means purified form of the Bordetella pertussis bacterial component is giving. So it has lesser side effect compared to entire whole celled pertussis components like in DTP. Okay, DTaP is used for children under 7 years of age. It contains higher doses of diphtheria and pertussis components because in this age group, children's immune system is immature, so higher doses is required to trigger antibody response. Then Tdap for older children for greater than or equal to 7 years of age, adolescents and adults. It contains lower doses of diphtheria and pertussis components to reduce the side effects in older individuals. Okay, and TD contains only tetanus and diphtherial component, no pertussis. It is used for booster doses in adults. And remember, the dose volume doesn't vary, but the formulations like DTaP, Tdap, or TD and the schedule may differ depending upon the person's age, vaccination history, and purpose of administration, whether it is as a part of routine immunization or for wound prophylaxis. So, before giving tetanus component, check the vaccination history to determine additional doses or booster doses are required. So let's check about wound prophylaxis. If a person comes to hospital with a wound, before giving TT vaccines or TT immunoglobulin, we should check the type of wound and vaccination history, TT vaccination history. Type of wound means check for clean or minor wound or tetanus prone wound. Clean or minor wounds means not contaminated with dirt, saliva or feces. It is superficial wound. No significant tissue injuries there. In tetanus prone wound, it is deep punctured wound contaminated with soil, feces and saliva, injuries, burns, frostbite, wound with dead tissue. Okay. Then regarding tetanus vaccination history, if he had received 3 or more TT doses and that was less than 10 years, then no TT required for clean or minor wounds. But greater than 10 years, 1 booster dose is required. And regarding clean and minor wounds, if the vaccination history is unknown or fewer than 3 doses, then administer 1 dose TT. And in case of tetanus prone wound, if he had received 3 or more TT doses and that was less than 5 years, no TT is required, but greater than 5 years, TT booster is required. And in case of tetanus prone wound or high risk wound, if the vaccination history is unknown or fewer than 3, then along with 1 TT booster dose, tetanus immunoglobulin is also required. Here is our question. Dose of tetanus toxoid: 2 ml, 2.5 ml, 1 ml or 0.5 ml. It is 0.5 ml. And it is giving us IM deltoid for adult, vastus lateralis for infants. 0.5 ml is recommended for all individuals regardless of age, weight in all formulations of tetanus. Means 0.5 ml is sufficient to trigger immune response to produce antibodies against tetanospasm. So let's stop today's session. If any doubt, ask us comment. Keep watching. Thank you.